What excites me about neurology is that there's so little that we understand really about the brain and how it functions, and also how the brain's functions impact disease. There's so little that we know about the treatment opportunities that there are available for neurologic diseases. And every single neurology resident or physician who is studying the brain can discover something that could change patient care for years to come.
Something that surprised me about this program is just the great pathology we take care of on the floor. I feel like we have patients with diseases that I had never been exposed to, or patients with types of strokes I didn't even know existed.
Just being here is hard to describe. Once you walk through the atrium of Sinai, the sun rays hit the glass ceiling and hits the floor into the reflection, and there's just a sense of energy that you feel. My name is Rafiq Haynes. I'm currently one of the Neurology PGY2 residents.
My name's Alana Green. I'm a PGY2 resident in the neurology program.
My name's Kapil Gururangan. I'm a PGY4 chief resident at Mount Sinai Hospital. It all starts with being well rested.
Good morning.
Good morning.
How are you?
I'm good. How are you doing? Having a good cup of coffee. My usual.
Yeah.
Awesome. Thank you. When you wake up feeling rested and you wake up knowing that it's another great day at the hospital, it sets the tone for the rest of your day.
So we're heading to Mount Sinai. We're going to be going to Annenberg Building, floor 14, which is where our morning report is. And that's one of our main educational programs for the day.
What am I going to see today? And how am I going to handle it?
Hey, good morning.
Like the main complaint was the double vision. And then I think she was associating this other.
They name it according to the vessel that they're injecting, so this is the left ICA, which is where we would hope the aneurysm would be visible through.
Goes across the neck there. So it just literally forces the blood through where it's supposed to go.
And then this time right now is doing little things, answering questions, checking in with the med students. Hello. How's our guy doing? Okay, I'm gonna look in his chart. Figuring out what I'm gonna say when we round on the patients, what my plan is. Did he fever overnight?
I was gonna see him again. Since yesterday he had like two different sides of him, from pre-morning report and post-morning report.
All day we're just kind of responding to what the patient's doing, what our nurses might need, constantly figuring things out.
A lot of the diagnostic thinking on any neurology surface happens in those first couple hours.
Hi, Mr. Carlos. How are you feeling today?
4 meses, 5 meses, algo así.
Where you're getting acquainted with your patients, looking in the charts, and reviewing whatever lab tests that you've ordered, and setting the tone for what your plan is going to be.
Okay. Now follow my finger with your eyes only.
As program director, I am very careful to make sure that my residents have the right amount of autonomy. Could you give us the highlights of the rest of the exam?
Yeah, so she's able to follow simple and complex commands with the left upper extremity but not the right.
100% of the time, a resident is supported by faculty.
I think I have no idea what's going on.
That's okay, that's okay.
Yeah.
We're all in this together. I want you to pretend you are writing the script for a movie. And I know you know this, but it's just an easy way to sometimes like fill in these details. There's always a faculty member available 24/7 to call, to ask questions to run the case by. And so a resident really is never alone in our program, but at the end they really are the ones that are making most of the decisions. So, assessment on this patient. What do you think? It's very important to us here that when a resident leaves, they're ready to be a neurologist on their own.
Today he was 7.9, the day before he was 7.7, today he's 8.4.
He was 10.9 on the 12.
Oh, was he?
We got to go into social work or interdisciplinary rounds where we talk about each patient. Good morning. We talk to PT, OT, social work, case management. I think she might be ready mid next week. A lot of the patients go to acute rehab. Are they going to go to subacute rehab? What's their timeline? How are they doing? How close to discharge? So probably like mid to late next week. Okay.
In the afternoon, we're executing the plan of care that we decided on in the morning.
So she's getting a little bit of vision sort of in the nasal field on the left eye.
We're following up on tests.
Follow with your eyes.
Yeah.
That hurts when it goes all the way over there.
We're checking in on the patients that needed to have
Try going
a
down.
follow-up exam.
I can actually see more.
That's amazing. You're really starting to make progress.
I don't know where else in the world you would see more diverse neuropathology than here.
We do see a variety of cases, something as simple as a tremor to a patient who has like prior stroke, someone who has new weakness, for example, to things such as different movement disorders. So there's quite a spectrum of cases that we can see here at clinic. Hey, when you feel me touching your face, just tell me yes, okay?
There's just so many options of types of neurology you might not even think you might be interested in that you can be exposed to here that I'm not sure you can really get everywhere else.
We're going to see a young woman who came in with really severe headaches after getting the COVID vaccine. And we do see this from time to time, and that's not uncommon. So we'll be seeing her and seeing whether we can tie the weakness with the headaches together into something that might be able to form a diagnosis.
Vestibular neurology, we have an attending who does neuropalliative care, we have neuroinfectious disease, we have a great neurocritical care department, so we just have great representation of all these different subspecialties of neurology that you might not even really know exist if your program doesn't have them.
I think Mount Sinai is a great place to do neurology residency because it has it all. First of all, you're in New York City. Who wouldn't want to live in one of the most exciting cities in the world?
I was looking for location, which New York City made a lot of sense to me. Other than location, the most important thing to me is the people, because residency is so hard and it's long and you need to enjoy who you're with.
The way that we support each other is something that is palpable. It's something that's in the air at Mount Sinai.
I do really think that being a doctor, you have an opportunity that is somewhat unique in society. It may sound idealistic, but really with every patient, you do have a chance to make a difference.
We're figuring out what needs to happen for the rest of the evening so that we can sign it out to the night team.
At the end of the day, I sit down and do all the notes for each visit. It's a little bit easier to do it at the end of the day rather than in between the visits because things can get a little bit more hectic.
I think that the type of person that goes into neurology is a person that really loves the human story. You really have to be connected to that human story. I hope my residents learned from that. You really have an opportunity with each and every patient that you encounter to change their life for the better. And you really have to seize that opportunity. And that's my goal.
At the end of the day, I really feel like I've done a good job. And ultimately, that's one of the best feelings you can have at the end of the day, to feel like you've really helped your patients, worked well as a team, and have contributed something to the world that day. And far from being tired, I go home thinking, what else can I do?
Some of my co-residents, there's only 10 in each year, which is a lot actually for a residency program to have 10 per year. They're honestly my best friends in New York City now.
Let's all do something.
We want to hang out inside the hospital, but they're also the people I want to spend time with outside the hospital. I've been so happy with the people I've met here. I'm so happy to be doing my residency here at Mount Sinai. I feel like I found my family. I feel like I'm getting a fantastic neurology education. There's nowhere else I'd rather be.